Welcome to this video on mastering the 6M's in advanced dementia care. In this video, we explore 6 key areas for enhancing the quality of life for individuals with advanced dementia. What matters, meaningful activities, mealtime, mobility, medications and treatments, and making personal care comfortable. The centerpiece of our discussion is the 6M Interactive Care Plan, a comprehensive tool designed to address the specific needs of individuals with advanced dementia. This tool enables caregivers to assess the individual's preferences, abilities, and care requirements within each domain, facilitating personalized and holistic care planning. By utilizing the 6M Interactive Care Plan, family caregivers can collaborate with healthcare professionals to develop tailored strategies that prioritize the individual's comfort, well-being, and quality of life throughout the dementia journey. Now, let's delve into each of the 6M's to gain a deeper understanding of how they contribute to enhancing the quality of life for individuals with advanced dementia. Let's explore the first M, what matters. This M refers to recognizing and addressing what's most important to the individual living with dementia and their caregivers. Questions to consider are: what does the person like to be called? How would they describe themselves? Who are the important people in their lives? What is their biggest accomplishments? And what cultural, spiritual, or religious practices are meaningful to them? Knowing this information is important because it helps us understand one's identity, relationships, and personal achievements, all important to respecting well-being and quality of life. For example, Sarah's been known as Dr. Sarah ever since she finished medical school and enjoys when people call her Dr. Sarah. But her healthcare providers never knew that she was a doctor and only called her Sarah. Imagine the sparkle in her eye when she is again called by her preferred and esteemed title. Information about what matters also helps caregivers see beyond the dementia and establish a meaningful and empathic connection with the person, recognizing them as a unique individual with a rich life story. By considering aspects such as long-held spiritual beliefs or practices, caregivers can provide a sense of comfort and connection, allowing individuals to feel valued and understood despite the challenges of dementia. Now, moving on to the second M, which stands for meaningful activities. To establish meaningful connections and engage individuals with advanced dementia, it's helpful to understand their favorite hobbies, interests, and activities. By adapting activities and their environment to their life experience, we can provide comfort, encourage social interaction, and create a sense of connection and fulfillment. Questions to consider are: what strategies are most helpful in ensuring effective communication? Consider things like vision, hearing, language. What were their favorite hobbies? What are their favorite activities now? What activities, surroundings, or sensory experiences make them comfortable? Imagine this scenario. David's an individual with advanced dementia who used to be an avid gardener. Despite his cognitive challenges, when you introduce him to a simple gardening activity like potting a plant, it sparks a sense of familiarity and purpose. He may not remember your name, but he remembers the joy of tending to plants. In that moment, you've created a meaningful connection and brought a smile to his face. By adapting activities in their environment to align with their past interests and hobbies and life experiences, we can provide comfort, encourage social interaction, and create a sense of connection and fulfillment. Now, let's delve into the third M, mealtimes. Important questions to consider are: what part of mealtime brings the most happiness to the person with dementia? What are their favorite foods or drinks? Keep in mind things like temperature, consistency, and textures. What methods or strategies work best when helping them to eat? Consider techniques such as utensils, pacing, or an environment. Imagine someone with advanced dementia who has always enjoyed chocolate ice cream. Despite cognitive challenges, the simple act of spoon-feeding them a favorite food can bring genuine comfort. Keep in mind that mealtimes aren't just about nourishment. Mealtime is an opportunity for social connection and shared enjoyment. Be sure to prioritize not only the nutritional aspect of meals, but also the emotional and social significance. Take the time to consider how to create a comfortable and enjoyable environment where they can savor their favorite foods and the companionship of those around them. Let's now explore the fourth M, mobility. While losing the ability to walk safely is a feature of advanced dementia, we can identify strategies that help people remain mobile and comfortable in bed, chairs, and when moving around their surroundings. Things to consider are: what techniques are most effective in ensuring comfortable transfers and positioning? What activities help them stay as active as possible? What type of surroundings or specific places do they find most pleasing or comfortable? For instance, consider an individual with advanced dementia who used to take great pleasure in sitting in the sun, feeling its warmth on their skin, and listening to the soothing sounds of birds. Although their ability to walk may have diminished, providing them with a comfortable outdoor seating area can still allow them to enjoy these sensory experiences. By using a wheelchair or other mobility aids, they can continue to access the outdoor space safely, fostering a sense of connection with nature and enhancing their overall well-being. The fifth M is medication and treatments. People with dementia may find it uncomfortable to take medications or undergo certain treatments. They may also be more sensitive to certain medications and experience uncomfortable or harmful side effects, such as dry mouth, dizziness, or loss of appetite. For these reasons, it's especially important to carefully review their medications and treatments and consider which medications and treatments are necessary to their health and which ones are causing more discomfort than benefit. Consider having a conversation with a healthcare provider to explore potential medications and treatment options. Some questions to ask here are: what is the most comfortable way for the individual with dementia to take their medications? What medications or treatments are they using that help make them comfortable? Are there medications that may be causing them discomfort? And are there treatments that they undergo that may be causing them more discomfort than benefit? The goal is to carefully consider the risks and benefits of medication or treatment options. Remain open to adding medications or treatments to treat discomfort, while also considering eliminating unnecessary medications. For example, medications that were helpful in early stages of dementia may lose their effectiveness as the disease progresses. The final M is make personal care comfortable. When people have advanced dementia, they struggle to use words to express their discomfort. That's why it's crucial for us to listen with both our ears and our hearts, particularly when offering personal care, to recognize and apply strategies that prevent any discomfort. Some questions to answer are: what signs or nonverbal cues help you identify discomfort or distress? What strategies are effective in providing comfort when they are distressed? What techniques or strategies make personal care activities such as bathing, dressing, toileting, and positioning more comfortable and distress-free? For example, Akira often becomes frightened during showers. However, her caregivers discovered that by allowing her enough time for bathing, playing music, and adding bubbles to the tub, and having a female caregiver assist her while allowing her to enter the tub with a towel, they could reduce her embarrassment and make bathing easier for her. Now that you're familiar with the 6M's and understand their significance in dementia care, you're ready to utilize the 6M Interactive Care Plan to tailor personalized and holistic care for your loved one. Here's how to use the 6M Interactive Care Plan. First, use the care plan to share information about your loved one that you're comfortable disclosing. You can leave blanks if you prefer not to answer certain questions. Remember, not every question requires an answer, and it's perfectly fine to skip any that you're not comfortable with. Second, collaboration's key. Your insights are invaluable alongside the contribution of the care team. Share the completed worksheet with healthcare providers, nurses, and other family or friends involved in your loved one's care. They can add important details and suggestions based on their own observations and expertise. Consider displaying the completed 6M care plan in a prominent location, accessible to all caregivers. This fosters a shared understanding of what matters most to your loved one and how to make them most comfortable. It's important to periodically review and update the care plan to ensure it remains aligned with your loved one's evolving needs and desires. By keeping the care plan up to date, you can ensure that your loved one receives the best possible care tailored to their preferences and comfort. As we conclude this video, it's essential to recognize the profound impact that mastering the 6M's of advanced dementia care can have on the quality of life of individuals with dementia. By prioritizing what matters, meaningful activities, mealtime, mobility, medications and treatments, and making personal care comfortable, caregivers can create an environment that promotes comfort, dignity, and well-being. Remember, each person with dementia is unique, and their care should be tailored to their individual preferences and needs. By incorporating the principles of the 6M's into care planning and daily interactions, caregivers can make a meaningful difference in the lives of those they care for. Thank you for watching this video, and we hope it provided you with valuable insights and tools to support you on your caregiving journey. Thank you for your time, and I look forward to seeing you in the next video.